Doris. This is a celebration and a recognition of nurses, but I also want to take just very short 60 seconds to acknowledge our professional association, the RNAO. There are two things that I'd really like to profile about the RNAO. One is their work with Best Practice Spotlight organization, the BPSO program that they have now to really using evidence-based practice is resulting in improved patient outcomes and is across 15 countries and 1,000 organizations. That is such an important piece of work. It's been supported through Health Canada. It's been supported by Indigenous Services Canada. It has been supported by the Ontario government, and through your leadership, RNAO, it's made a huge difference for the care of residents around the world and in our country and locally. And one other program, we never knew that in Year of the Nurse, the WHO, that we would have COVID on top of this, but here we are. And we, on March 13th, found ourselves in a community really struggling to meet the needs of residents, as did other health units across the province. The RNAO came through. They were really the backbone of helping us provide the service that we're doing today through their Via Nurse program. They were able to deploy nurses to us, to other organizations within days. In 3 days, we had 40 nurses that you brought to us, experienced nurses like Rosemary and other nurses throughout organizations throughout the entire province. Thank you so much. Our deep gratitude and appreciation to you, Doris, for working with us and making that happen. And I won't take any other time as to not take away from our tour. And I think one of our VIA nurses has joined us, Rosemary Pam, who's really led the onboarding of VIA nurses. So perhaps I'll turn it to you, and thank you very much. Rosemary, what's your experience been like?
It's been really neat. I mean, the email went out from the RNAO saying we need nurses. I work in private care, so a lot of things were sort of closing down, and it was like, absolutely, how can I help? And just
So where did you work before?
I work in private rehab. I deal with people that have car accidents,
okay.
And then I coordinate their care in the community. And so available and great experience with Ottawa Public Health as well. Just it's a moving target. There's been a lot of flexibility needed. The messaging has been, as you have been doing, changing sometimes every day. And then to support the community and figuring out what it is I'm supposed to do and encouraging them to do what they're supposed to has been fabulous to be part of it.
Now, do you want to speak to all the different types of nursing work that's underway? What has it been like?
Yeah, so certainly from our perspective, I mean, we have dealt with over 1,700 cases. We've had over 7,000 contacts that we've had to follow up with. So certainly the nurses who came from RNAO were vital in us being able to complete that work. I need to acknowledge, this is just me, that you certainly understand the impact of COVID on families. You had to live this for yourself. I would be remiss if I didn't mention it. As an organization, we're very grateful that your family is now healthy and well. We have supported many families where this has not been the long-term outcome, but certainly we're very happy that your dear wife Sophie recovered. Can't imagine what it was like for you folks to have to live it in the public eye. We do know how families have struggled in dealing with this diagnosis and the convalescence, but very proud that you're here today because you really do understand the impact of this virus. So back to the celebratory stuff. We are very grateful that the RNA nurses came to assist. We had over 100 nurses at one time who came. There were incredible challenges as new folks were starting 40, 50 a day, trying to figure out how we were going to train all these folks. And as nurses, they have definitely risen to the occasion. We're so proud to call them our own now. And I think we'll always have a soft spot in our heart for them moving forward. And they'll always be part of the OPH family for sure.
So tell me about it sort of tangibly. I mean, there's nurses who are doing incredible work sort of on the front lines in patient care. There's a lot of nurses doing the contact tracing, doing the advising, the wonderful woman who was on the other end of the line from my wife as she was asking, okay, what does this mean? How can I protect my family? How do we go through this over the next days? How do you handle the range of tasks that you could be pulled in different directions on?
Yeah, so for the case and contact management, that is what we do here at Ottawa Public Health. That is our role, following up with all of the cases, identifying who the contacts are, reaching out to them, helping them understand what it means to be a contact, whether they're a close contact and need to go into self-isolation, or are they a more removed contact and they just need to monitor for symptoms. That's all of what we do here at Ottawa Public Health. In addition to that, we have also served as a resource to the community at large, our community physicians, our hospitals, our long-term care facilities, both in our visits there, as well as we run an emergency response phone line for months now, being available day and night for the folks that need to reach out to us to understand how they need to respond to this infection.
So typically someone would call up and say, 2 days ago, I had a conversation with my grocer, and I just went back today or heard that they've now tested positive. So I may have had a contact with someone who may have been positive. What do I do? And you talk them through those sorts of steps.
Yes, that is our role, is to provide the most up-to-date information that we can. And as Vera alluded to, trying to stay on top of it has been a bit of a challenge as we learn more about this infection. But we do have folks that pull the daily information to make sure that our nurses have all of the information they require at hand to be able to answer any questions that we may have. In addition to that, we're also very fortunate as well that we have a public health medicine unit, which is made up of our associate medical officers of health, and they are conversing with our partners across the province and across the country to make sure that we make the most informed decision for the citizens of Ottawa.
Chris, did you want to add any last words as we prepare to head upstairs?
As the Region 10 board member rep for the RNANO, I also wanted to express gratitude around the students who are members of the RNANO and our ability to access students for our long-term care facilities to assist in PSW roles and things of that nature. That was a fabulous bonus, and I know some of my other colleagues in our health sector really reached out and utilized that service as well. Again, thank you very much for joining us. And again, it's International Year of the Nurse, and it's a year, it's not a week. But we're hoping that the COVID might not be a year, but we're also doing great work, like Angela said, every day, in the past, now, and in the future. The new motto is flexible like Gumby.
And Prime Minister, the year of the nurse, and what did nurses do? As always, put patients first, as always. We turn it into the year of the patient, and here we are serving patients day in and day out in circumstances that especially the younger generation never imagined, and they're stepping up to the plate doing formidable work.
Thank you. Before we go up, I just wanted to say this has been a real privilege to be able to sit down with you, to be able to come, to be able to highlight how important it is that nurses get the support that you need to keep us safe, and the work that you're doing. If there was ever a moment in which people recognize the extraordinary frontline work of our medical professionals and the ubiquity and incredible abilities of our RNs and the nursing community, it's now, it has been absolutely heroic. I also want to say, sort of off the top, that thank you, Pam, for your kind words about my family. But I mean, if I had to, really reflect on it, the fact that it got so real for us so quickly from the very beginning, I think was part of what put Canada into action in a very complete way very quickly. And there were conversations around my household that, sort of went along the lines of, what do you mean you have to announce to everyone that I have COVID? I don't think that's a very good idea. I said, no, this is an important thing that we need to share. We need to use this as a trigger that anyone can get this, and we have to start behaving. And it was a tricky time on top of everything else. But of course, Sophie made it through just fine with some great advice. There was a few very, very unpleasant days, and we all kept our distance. But close quarters means that it is likely that myself and my kids might have gotten it as well. Had no symptoms at all, so we'll look forward to the serological test to find out whether or not we had them as a question of curiosity. But I think it really set us on, certainly me, in a mindset of how serious this was, and allowed us to move forward in a very deliberate way to keep people safe. But the thing that we really have to remember is, regardless of actions the government might have taken or not, Canadians themselves were in a situation where people have trust in their institutions, particularly in their medical professionals. And when our frontline medical officers, our top chief public health officers, were all saying the same things, and people, chose to listen to them and chose to, for the most part, follow those recommendations. And a few weeks later, we started to see that things weren't as bad as they could be. There was a sense of, okay, our institutions are serving us well, so we will continue to follow their recommendations, and you get that virtuous cycle. But you only get that if people can have confidence in the institutions that surround them, and the medical staff, and particularly the nurses engaged in contact tracing, in terms of frontline patient care, in terms of everything that is the patient-focused part of our medical profession, has been exemplary. And we all are reflecting on the tremendous tragedies that are particularly striking our long-term care residences and homes, and that highlights some long-term changes we're going to have to make as a society about how we make sure not just our elders are protected, but those who care for our elders and are themselves extraordinarily economically vulnerable many times are getting the proper support as well. And there's reflections we have, and I have made careful note, Doris, of the request for a chief nursing officer of Canada, and we will of course put that in the buckets of things that we need to reflect on as we try and build a better world and a better society. But I know as we move forward, our reliance on science, our reliance on the service that you all exemplify in such an extraordinary way, makes it a real pleasure for me to be able to be here today, to say thank you, to hear from you on the challenges that you're facing, and of course to continue to work hand in hand, well, glove in glove perhaps, over the coming months to make sure that we're doing everything we can to keep Canadians safe and help the world get through this as well. So thank you very much for the time with me today. Yes, Doris, you have one more thing to add?
I absolutely need to, because you're very humble, and you did not take credit, but you need to understand all that you said is true, and all that you said we accept, and all the kudos and all the people listening and the institutions, that's all true. But when there is a leader at the top that is not the right leader, and I am not going to mention names close to us, things go awry, even with good institutions. When there is a leader at the top that is in tune with reality,